Hello, friends. Welcome to the Learning Channel, a platform for learning laparoscopy, endoscopy, artificial intelligence, and robotic surgery. So, this is a case of a patient who was diagnosed with gallstones and CBD stones. So, the patient first underwent a ERCP with CBD stone removal and stenting, followed by a lab cholecystectomy. Now, the patient has come to us after cholecystectomy for the removal of the CBD stent. So, on side wings endoscopy, when we reach the second part of the duodenum, we could clearly see the sphincterotomized papilla there. However, the lower end of the CBD stent was not seen within the duodenum. So, an on table fluoroscopy was done to rule out any migration of the stent. But on fluoroscopy, we could see that the stent was still present within the CBD. So, this was a case of a proximal migration of the previously placed CBD stent to retrieve now endoscopically. Migrated CBD stents can be retrieved under the guidance of fluoroscopy with the use of either a Dormia basket or a balloon. In this case, you will see the use of a biliary balloon for the retrieval of a proximally migrated CBD stent. So we started by putting a guide wire through the already sphincterotomized papilla, and over the guide wire, this biliary balloon is now being advanced into the CBD while we are checking the position of the stent as well as the balloon via fluoroscopy. So once we are able to introduce this balloon, we are trying to place it somewhere around the upper end of the migrated stent. The position of the balloon relative to the stent is now being confirmed with the use of a fluoroscopy. And as you can see in this adjoining image, the black dot represents the position of the balloon, and the long CBD stent is also seen lying within the lumen of the duct. Now we are going to distend the biliary balloon and bring it out from the papilla. This maneuver usually helps drag the stent distally and bring the lower end of the stent into the duodenum. Once the stent is in the duodenum, it is retrieved with the help of a snare. Care must be taken when snaring the stent so as not to catch the adjoining duodenal wall or a part of the papilla within the snare. Once we have a correct and a firm grip over the stent, then it is retrieved along with the endoscope and the procedure is over.